Hello, hello, hello. Welcome to Wellness by Design today. I'm Jane Hogan, the wellness engineer, and today we're going to be talking about chronic brain, gut issues, and the immune system and how it's all interrelated. I'm really excited to welcome our guest today, Dr. Peter Kahn. Welcome, Dr. Kahn.
Thank you so much for having me, Jane. It's a pleasure to be here.
I've been following your work for a while, and I know what you're doing is so valuable in showing people this connection that some people may be aware of, some people may not be aware of. So, I'm going to tell everyone a little bit about you before we start. Dr. Khan supports and manages clients with chronic conditions using a comprehensive approach by merging the exciting advances of functional neurology and functional medicine. Dr. Khan is board certified in integrative medicine, functional medicine, and board certified chiropractic neurologist. He is the creator of NeuroMetabolic Integration, a science based virtual online coaching program that identifies the root cause of autoimmune and other chronic conditions. Over 5,000 clients from across the country have come to seek out his holistic approach that is changing the lives of those suffering from chronic conditions. Born in Taiwan and immigrated to America at the age of 13, Dr. Khan has a deep appreciation of Eastern wisdom and Western advances in natural health care. Dr. Khan, welcome.
Thank you so much for having me again.
I love how you blend like the Eastern and the Western together to really come up with this program that you've got that helps people. And so, what is the common thread that we see when you see people with the chronic brain, gut, immune problems? What is the connection with all of that?
Yeah, that's really interesting because how I stumbled onto it, Jane, is I had a very high level functional medicine practice, and people come to me with very complex conditions. Many of these people come to me with, say, Lyme disease or chronic mold issues or Hashimoto's or some type of autoimmune issues. And what I started to notice is that between all these people with different diagnoses or different labels, they have very similar symptoms in different areas. For example, they all seem to all have some type of brain impairment, whether that be brain fog or fatigue, depression, anxiety, lack of motivation, short-term memory loss, or even numbness, tingling, or balance problems. Invariably, they'll have some degree of some of these problems, right? Maybe not all of them, but maybe one or two of those symptoms check the box. So those are all brain symptoms between different people with different diagnoses that have chronic issues, and even fibromyalgia and chronic pain. And then we also notice that people with these chronic conditions, regardless of the labels and diagnosis, all have some degree of immune system challenges. And this could show up as inflammation, chronic pain. They could have chronic infections that they can't clear, like chronic viruses like Epstein-Barr, like chronic parasitic infection, candida overgrowth that they can't clear, or SIBO that they can't clear. And then they may have, as far as immune system challenges, have autoimmune, not necessarily autoimmune disease that's definitively diagnosed, but maybe suspicious of autoimmune reactions. So then they bounce around from doctor to doctor. Nobody really can figure them out because they're not in a disease stage yet, but yet they have all the signs and symptoms. So they become an enigma and a puzzle. And they say, oh, you're a tough case. We don't know what's wrong with you. They get passed around because doctors are not understanding how the brain, the immune system, and the gut are connected. And then lastly, between all these people with different labels and diagnoses, they all invariably have some kind of GI dysfunction, be it gas and bloating, heartburn, reflux. Maybe they're told they have leaky gut or they feel they have leaky gut, or they may have some kind of chronic dysbiosis, may have SIBO, candida overgrowth, parasitic infections. And then they may also have food sensitivity reactions. They can't take any supplements and they react to everything. So what I started to notice is the pattern between the brain, the immune system, and the gut. These clusters of symptoms that show up regardless of what kind of label and diagnosis that they have. Now, this presented actually an opportunity because when people show up with brain, immune, gut symptoms, regardless of the label, that means the label or the diagnosis is not that important because you can get diagnosed with chronic pain or fibromyalgia. It doesn't tell you what's causing the chronic pain or fibromyalgia.
Right.
I mean, you can get diagnosed with high blood pressure, and that doesn't tell you why you have the high blood pressure, right? So we want to swim more upstream and look at the mechanism that's causing the symptom downstream. And the brain immune gut symptoms is really the manifestation of something that's upstream that's creating these brain immune gut challenges, but then they get, put in a bucket or label of fibromyalgia or Lyme disease or Hashimoto's. I think it's important for us to understand that the brain immune gut axis, there's an interconnection between them all. And when this brain immune gut axis start to dysfunction, they all dysfunction together, because it's kind of like a domino. When one domino falls, the other domino within the brain immune gut axis falls as well. So not only do you get gut issues, may have started with gut issues, but now spills into having brain symptom as well. Maybe you started having brain symptoms, but now spills into having gut issues. Or you started having inflammation, but now spills into brain and gut issues. So they're all interconnected. And when we start to understand that interconnection better and know how to leverage that and harness it, then we start to simplify these chronic conditions. Instead of thinking that you have 50 different problems and you're taking 50 different supplements, you start to simplify things and start to look at the common thread or common denominator and start to be able to come up with a process to untangle these chronic issues. I find that this very liberating for people to know that, because they stop thinking that they're broken and they have 50 things wrong with them, and they stop being jaded, going through all these doctor and treatment that just doesn't seem to work because there's no cohesiveness to how they're trying to approach the problem. So the biggest thing I can share with the audience is that it's more about how you think and how you arrive at what's the root cause of your problem, right? That methodology and that thought process is more important than the actual supplement or the actual treatment that you do. Because the supplement or the treatment or lifestyle, the nutrition, whatever intervention you might choose, that's pretty simple once you know what the actual real problem is. And I think a lot of people are just struggling to even know what the real problem is. They kind of assume they have XYZ problem. So they're trying XYZ things for the XYZ problem they think they have, but they actually have ABC problem, not XYZ problem. So this process helps people to actually empower themselves to be able to identify that in themselves.
I love the empowerment. That's exactly what this program is really about, is empowering people. And when people do get one of those diagnoses of a chronic condition, then there's also the stress around that, right? Which probably worsens things, because they're probably Googling and seeing, oh, there's no real solution for this. And what am I going to do? I'm going to be on these medications for all my life. And then sometimes if they can't work, they're getting stressed. So there's so much that's packed in around that. And I love the way you kind of take it back and say, all right, it could all be all these downstream things. It doesn't really matter what that is. We need to get to the upstream and deal with that. So where do you begin with that then?
Yeah, and how I begin is that it's actually, you don't begin with the brain, immune, or gut, because the brain, immune, gut is simply the kind of the system that gets damaged by various inputs or various signals into the body that's damaging, right? So you can call these root causes if you like, but so some of these things could include things like environmental toxin exposure. Right. It can include things like getting exposed to some type of, infection. But really, when we think about infection, you have acute infections, right? These are viruses or bacteria or pathogen that are predatory, meaning they're there to really cause a lot of damage, and it could potentially be deadly. Like, we need to treat those seriously. And there's a time and place for medications and medicine, right? But then we also have people with chronic infections. And when people have chronic infection, we have to stop thinking that you caught something, because many of these things that people have chronic infections with, these pathogens, are things that you already have caught a long time ago. For example, Epstein-Barr.
Yeah.
90% of people have been exposed to Epstein-Barr. So it's not a matter of catching it. It's whether your immune system is working properly to be able to keep the virus in a dormant state. If not, then these viruses get reactivated. So many times, Epstein-Barr or herpes simplex 1 or Lyme disease, even, like, these things, they can, become reactivated, or they can be suppressed into a dormant stage. And I find that people with a lot of problem with these chronic infections are the ones where their immune system is not working properly. So then the next question is, what's causing the immune system to not work properly? Well, we talk about environmental toxin. That's certainly a big factor in contributing to immune suppression. Many of these toxins can get stored in the bone marrow and suppress bone marrow, white blood cell production, even red blood cell production, can cause leukemia and things like that. They can also act on various cytokines and other messengers and hormone system to sort of disrupt the immune system to the point where you cannot properly regulate immune function, and therefore you get sick easier. Right. So that's toxins, and we talk about infection. But then other things that can throw off the brain immune gut axis will be things like blood sugar problems, right? So if you have hypoglycemia or insulin resistance or pre-diabetic or you're already diabetic, that's a really huge source of insult to your brain, immune, and gut system. In fact, I would say blood sugar is one of those things where it is so inflammatory and it's so common, and it damages all three systems, the brain, the immune system, and the gut directly. That is one of those things that it's a low-hanging fruit that everybody should be looking at their blood sugar and learn how to manage it, learn what the signs and symptoms are, and be able to do it themselves, a lot of it, right? Because blood sugar is one of those things that's very lifestyle modifiable. And then other things that can impact the brain, immune, gut will be things like hypoxia. Hypoxia is a state of low oxygen. This could be caused by anemia, poor circulation, low blood pressure, or high blood pressure. All of these can be caused by inflammatory issues. So inflammation can contribute to some of these circulatory problems. So again, we have to kind of start think about it not so linear. We have to think of it as non-linear, but at the same time, think of it as like a roadmap, right? There's steps you need to take, one before the other. And if you start to try to fix everything all at one time, it may be kind of overwhelming. So what we always teach people is that, okay, there's a priority sequence or a triage type of approach so that you're addressing the first things first, and that'll give you better results. And as I alluded to just now, is the oxygenation issue, the hypoxia and blood sugar. That will be like the first thing you want to tackle. And then like detoxification will be things that you tackle later on, because if you're unstable with oxygen delivery, with blood sugar delivery, you essentially are compromised metabolically speaking, and you're going to have a hard time doing detox or heal from leaky gut or doing anything else for that matter if you don't have the foundation set properly.
Makes so much sense. And I've heard, I was listening to Dr. Bruce Lipton recently talking about what you were saying there about these viruses and bacteria and yeast and so on. We have them in our body, but they're opportunistic, so they will activate when we have when the situation is right. So these you're identifying some of the conditions that can cause that right situation where they can begin to activate. So I'm just curious, because I teach a lot with breath work, and you mentioned the oxygenation, have you seen much success with teaching people breath work techniques to help with oxygenation?
Well, breath work, I don't want people to think breath work as just for oxygen, right? Breath work is actually a way to regulate your autonomic nervous system.
Yeah.
Right? So it's really you can use breath work to self-regulate your autonomic nervous system to put yourself into a more parasympathetic state. So I don't want people to think breath work is just about oxygen. It's much more than that. It's very important. So I think you're doing some very amazing work and important work with teaching people about breath work. And certainly if someone is shallow breathing, they're constantly stressed mentally, and they're just not breathing properly, doing breath work can certainly improving their, breathing rate and oxygen intake through that mechanism. Mm-hmm. Know that also if someone is anemic, you can't necessarily do breath work and fix an anemia. Right? Because anemia is a state of low red blood cell hemoglobin or hematocrit on blood tests below the laboratory range. And if you have anemia, it means that, you have blood, you have pressure, you just don't have enough good stuff in the blood. That means the oxygen carrying capacity is low. So you can breathe all you want, but you're not going to jam more oxygen into the blood necessarily. It's actually a blood disorder. So and then there are many different causes, right? It could be iron deficiency anemia. It could be B12 deficiency anemia. It could be pernicious anemia. various different mechanisms.
Mm.
And so the important thing is to identify what's causing the anemia and not just clump all anemia together. Well, my doctor say my iron is normal, so I don't have anemia. That's not necessarily true. So you need to identify what's causing the anemia and then do the appropriate things for it.
You brought up something really important there, that it's like there's multi-pronged approach to this. But it's so multi-pronged, or can be, that it can seem overwhelming, and that's why it's important to have a step-by-step approach, which is what you do. So you mentioned blood sugar. How do you get people aware of their blood sugar? Like, is it continuous glucose monitor or testing, or how do you do that?
You can do continuous glucose monitor, but I find that blood sugar dysfunction is one of those things where symptoms are pretty reliable
Okay.
indicators. You can actually, if you're just aware of what symptom is produced when you have hypoglycemia and what symptoms are produced when you have insulin resistance, then you can pretty much self-identify whether you have hypoglycemia or insulin resistance. And then the solution to hypoglycemia, insulin resistance is slightly different. It's not exactly the same, right? For people who are hypoglycemic, we may tell them to eat small, frequent meals, right, in the beginning to stabilize their blood sugar so they don't experience hypoglycemia. Just so you know, the hypoglycemia means you have low blood glucose levels.
Yeah.
And sometimes it's very hard to catch on a blood sugar measurement. So people will do finger prick measurements. It's hard to catch that because by the time you feel hypoglycemic, your blood sugar might have rebounded already, but you still feel the symptom of it. So I find that doing finger prick testing for blood sugar is not as useful. It's not that rewarding. Continuous glucose monitoring might be a better idea if you want to do that. But simply, if you're just being aware of your symptom, you know that, hey, if I skip meal, I'm going to feel lightheaded, shaky, irritable, and hangry, then eat before that happens. Now, why am I making a big deal out of that? Because know that hypoglycemia symptom is a brain symptom. When you're hypoglycemic, it's not like, oh, it's in your blood. No, when you're hypoglycemic, what you're feeling is your neurons, your brain cells, not getting fed its primary energy source, which is really glucose and oxygen. So if you don't have glucose to your brain cells start to become unstable. They can't function correctly. They go through what's called neurodegeneration, which really is the first stage to neuronal death. So before neurons die, they kind of struggle, kind of like a cockroach that's about to die. It flip on its back and they're like, while it's on really fast. Like neurodegeneration is like before cells die, they kind of get all crazy. So you get at least spontaneous firing of the neurons that can generate like inconsistent symptoms. People may get migraines, people may get headaches, people may get like just really brain foggy, or they get anxious, different kind of symptoms. So when you get hypoglycemia, you really are losing brain cell. And we're not trying to speed that process up, right? We're trying to
Right.
preserve our brain cells because brain cells are post-mitotic. They don't go through mitosis or cell division. So what that means, whatever brain cells you get, that's how many brain cells you got for the rest of your life. And if you speed up the rate of neurodegeneration, you're risking Alzheimer, dementia, those type of processes. So it's all about protecting your brain. And hypoglycemia is one of those things that people don't understand. They think it's just like, oh, haha, I feel hangry. Like I would take it very seriously and really do things to prevent that from happening. And secondarily, identify what's causing the hypoglycemia in the first place, which can be due to various mechanisms, which we probably don't have time to go into it today. But I just want to bring that to the fore. And it's such an easy thing to address that, I think a lot of time people are missing that point. They just go for oh, well, I got to detox. I got to do heavy metal stuff. If your blood sugar is unstable, you can't really detox very well. One of the phase 2 liver detox pathways, glucuronidation, and that detox pathway requires stable blood sugar. In fact, it's a blood sugar driven mechanism. So if you don't have proper and when I say blood sugar driven mechanism, doesn't mean you go out and eat candy, right? What I mean is your blood glucose has to be stable. And
Right.
when you
Not
eat sugary,
spikes.
carby stuff, your blood sugar spikes, followed
Yeah.
by a crash, right? Reactive hypoglycemia. So the solution to stabilized blood sugar is not sugar in your diet, but rather a healthy blend of protein, fats, fiber, and things like that.
Mm. I think as soon as you start talking about brain cells dying and, or eventually leading to Alzheimer's and dementia, people really are afraid of that. And so, not that we want to scare anyone, but I think understanding that you're really being given a gift with these early symptoms because it's your body telling you it needs help, and your body can heal. I know that you believe that as well, that the body, if we give it the right environment, it can heal. So that's what you're all about, right? Is giving people the right environment so that the body can heal. So I know you said it's kind of too much to get into these, into what the first steps are, but you do have a program, right, where you can help people with this?
Yeah, and we have an online course, really a hybrid coaching program where it's a course, and then we do weekly group coaching where I teach people these concepts and teach them how to implement it in their lives. And the reason I did that because, I've been practicing for a long time, 15 years plus, in functional medicine. And a lot of times, we repeat the same information, right? Hey, you need to do this. You need to prevent hypoglycemia by doing that. And, my goal is to educate people. So by putting into a course, then people can learn this themselves and at their own pace with my guidance. So then it's just like kind of have like having office hour with me weekly. Then that people might not be able to afford to see me weekly in a one-on-one consult, but they can do this in a group course. So this makes it very affordable for people to be able to access very high level information while still having me as their mentor, as their guidance, to guide them in the process of understanding the body and be able to use this very powerful information for themselves in a step-by-step process. That's really the key, Jane, is that many people are doing things, they just Google things and they find something that sounds right, and they start to, take a supplement or doing a dietary or whatever intervention. And they end up accumulating and collecting a bunch of information, and they're doing a bunch of stuff, but there's no strategy. There's no cohesiveness to what they're trying to do based on anatomy and physiology, what the body's priority is. So that's what we teach. We teach you, okay, what's the first thing you need to do? What's the second thing you do? What's the third thing you do? So you're not chasing down rabbit holes and doing so many things that becomes inefficient and can be actually costly, or even if it's worse, can actually make you worse. A lot of people are just doing things or protocols that are kind of canceling each other out, or is actually making their condition worse. And they don't know it. They just think, well, I have a chronic condition, I'm still struggling with it. They just think what they do is right. But really, one thing I want to leave the audience is that, you're doing the right things if you feel better. Okay. If you're not feeling better, you're not doing the right thing. Because, well, healing takes time. Give me a couple of years. No, yes, you're right. It might take you some time to completely heal, right? But if you're doing the right thing, you should feel better within a few weeks, right? I'd always say to my clients, hey, every month you should feel some degree better. That's like stable, that stays with you. It's not like you get better and you're worse. You get better, you're worse. You should feel some better every single month if you're doing something right. So that if you're 10% better, well, you give it 10% per month, then times 10 months, that could potentially be 100% better, right? So you have to be patient. You have to have that long-term look, but you also have to know that you're doing the right thing. And how you know you're doing the right thing is if you're actually getting results. That's all that matters, right? It's not like, well, I'm doing this thing because some doctor says so. Well, it doesn't matter. Does it work for you? Because whatever is said on the internet is just general information. It may be right for someone else, but may not be right in your particular case. So it's all about understanding what's right in your particular case. And then so what we teach is that, okay, there's different scenarios and different options. Which one do you fit in, and teach you how to self-assess that, so then you can pick the right solution for your own particular situation. It's almost like it's customized.
Oh, Dr. Khan, that's so good. And we have access to so much stuff now on the internet, and
Too much stuff.
I'm guilty of that too. When I first started having symptoms, I was consulting Dr. Google all the time, and kind of all over the place. But you've got a program where people can use your guidance to identify what their next logical best step is, and then keep going, and then keep self-assessing and seeing where they are, and then just keep getting better, because you are giving them the protocol that is best match for them.
Absolutely. I mean, really, this is what doctors do too, right? They have to start with some differential diagnosis. They think like, okay, you come in with these set of symptoms. It could be these three possible diagnoses. I'm going to go with the one that I think is the most likely. And then they're going to give you some treatment, medication, or whatever it is they do. And that's called a trial, right? A clinical trial.
Mhm.
Let's see how you do with it. Come back in a month and we'll see how you respond. If you feel better, we know we're on the right track. If you don't feel better, we're off the right track. Then we try a different type of drug or different type of treatment. That's what MDs do. So this is, what do you call it? Uh, Empirical, right? Empirical meaning you're observing in yourself the facts. The fact is, are you better, right? If you're not better, then do something else. But what we do is we teach you to understand the mechanism so you know why this something would work for you. What's the mechanism on a cellular level and physiological level that you're trying to impact? So if you're better, then you know why you got better instead of, oh, I took this, I got better. I have no clue why, how it worked. You're going to know why it worked, because if it doesn't work, you also know that that's not the right physiological pathway. That's your particular problem. So you can intelligently change course without just shotgunning and guessing.
Mm. So it's like taking science experiments that have been done for many, and then you're doing a science experiment on yourself, seeing what works. You know your body, how you feel better than anyone else does, and then applying the protocols. So that's really great. What's the name of your program?
It's called NeuroMetabolic Integration. I know it's a long word, but it's actually something that I've created, 15 years ago. This I actually have a trademark on this terminology, neurometabolic integration. And the reason it's important to say that because it's really merging neuro, which is brain,
Yep.
neurology, and metabolic, which is like metabolism, which includes inflammation, leaky gut, blood sugar, hypoxia, all the things we talk about. It's merging those two together, integrating them, and putting it into a program where people can actually help themselves.
Oh, so good, so good. So where's the best place for people to find out more about you? I'll have a link to this program, but where can they find more about you?
Thank you for allowing me to share. Again, really one of the ways that people can actually learn about this brain immune gut axis is through our brain immune gut masterclass. And I'm sure Jane will put the link to this event so that you guys can, go ahead and click on it and be able to take to the place where you can register for the event. But that's a great place for you to kind of get started learning about the brain immune gut axis. I do have a lot of just free YouTube videos online, so you can just go to YouTube, Google Dr. Peter Khan, or not Google, search on YouTube Dr. Peter Khan, and bald-headed Chinese guy will pop up. Can't miss it. And there's I have over 400 videos on YouTube, so people can get a lot of free information there as well. And also
We'll
my main website, AskDrKhan.com.
Okay. We'll have all those links. All those links are provided for you. Just have a look at the show notes. And I always finish the show up, Dr. Khan, with one question. And this show is about intentional living and empowering people, like we talked about earlier. So, based on that, what's one thing someone could do today to improve their health? What would you suggest a baby step they took today could be?
Yeah. I mentioned earlier, stabilizing blood sugar is so important, right? And I've talked about, kind of touched on, if you're hypoglycemic, well, first of all, you have to know what the signs and symptoms are so you know that that's what you have. And then you can take steps like eating small, frequent meals to prevent hypoglycemia. And obviously, if you're insulin resistant, you'll do something different. But related to blood sugar, one of the things that really help with blood sugar is actually exercise. Okay, so
Mm.
I because I don't know the individual audience who are listening, whether they have hypoglycemia or insulin resistance or what other condition they have. And of course, we teach all that. But I think in general, everyone can benefit from exercise. Now, when I say exercise, specifically, I'm talking about true aerobic exercise, right? Because there's many different forms of exercise. There are exercise that are anaerobic, and there are exercise that are aerobic. And whether an exercise is aerobic or not has nothing to do with, what the class, at the gym says. Hey, this is a aerobic class. This is a cardio class. Like, just because something says it's cardio doesn't mean it's aerobic. Okay,
Right.
because like, for example, you can like do a spin class. It's considered a cardiovascular exercise, but you're not aerobic at all in a spin class, right? Because it's a really high intensity class. So you're actually anaerobic the whole time. And when you're anaerobic, it produces lactic acid, which is a hallmark of anaerobic exercise. You get the burn, and people perceive that with like, oh, that's good for me, right?
Right.
I would say the aerobic components very often ignore, because people assume that they're doing aerobic exercise and they're not. So aerobic exercise is actually when you're actually truly in aerobic zone. It's actually a lower intensity exercise and a longer duration exercise. lower intensity than what one might think. So you want to stay in the aerobic zone for a longer duration of time. And that's in general something everyone can benefit. Whether you're already exercising, you may or may not be doing enough aerobics. If you're not exercising at all and you're very out of shape, aerobic exercise will be a great entry point to get started. In either case, the aerobic exercise will tremendously benefit your blood sugar stability and help you with insulin resistance and help you with a lot of other things as well. So it's kind of like put on your running shoes and just go for a fast walk, and get your heart rate up so that you're in a true aerobic zone.
So tell the audience, how would they know if they're in that true aerobic zone?
Dr. Phil Maffetone, who's a doctor who's trained a lot of world triathlon champions. He's a chiropractor actually, but just took on kind of the sports medicine stuff. And he kind of came up with the MAF method, which is after his own name, but it's really maximum aerobic function. The formula is 180 minus your age. If you're on blood pressure meds or heart medication, you might want to subtract another 5 or 10 from that so that it's even easier and lower heart rate. Or you're someone who's really fragile, very out of shape, very overweight, you might want to subtract that by another 5 or 10 beats per minute so that you're working even in a lower heart rate zone in the beginning. But 180 minus age is a rough estimation of like that you will be in the aerobic zone. Okay. Again, it can vary between people because the true measurement is you got to do a VO2 max test where you hook up the machine on a treadmill, doing VO max tests, and not everybody have that ability to do that. So this is a rough estimation, but it's pretty close, right? Okay. And then usually for most people, it's going to tend to be a easier type of exercise for most people. I think for younger folks, it maybe seems harder because 180 minus a 20-year-old, that's 160. That's a pretty decent intensity exercise versus 180 minus an 80-year-old, that's 100 beats per minute. That may not be that difficult. So, but I think in general, this is a very good starting point for most people to start with.
And hold it for how long would they want to sustain that?
I say, minimum 30 minutes, 45 minutes will be optimal. And this can be done daily. And also, if somebody's really deconditioned or don't have time all in one shot, you can split it up, so you can do 15 minutes twice a day. So that's a total 30 minutes, or you can do 25 minutes twice a day. Then that's total 50 minutes. So that it doesn't have to be all in one shot, right? You can do 10 minutes 3 times a day. So you total 30 minutes. But it's better if it's all in one shot because aerobic exercise is something that's meant to be endurance activity. So that means it's longer duration. And the longer you're able to train yourself under the aerobic zone in one shot, the better. But if you have to split it up into 2 or 3 sessions per day, that still works. The good thing about this maximum aerobic function exercise is that you're in the aerobic zone the whole time. So conceivably, you can go forever unless you have some joint problem or other problem. Of course, if you're going to exercise, always consult your physician, make sure it's you're fine to do that. Yeah. But it's something that you can do for long durations. So everybody can benefit from it.
And do something that you love too. When I couldn't get out walking a lot because I had so much joint pain, I would sit in a chair and dance, and it's surprising, even sitting and like moving around
Absolutely.
a little bit, getting the arms pumping, you can get some exercise that way too.
Absolutely. Yeah. If you have knee problems, you should do upper body stuff, right? Yeah. Or you can swim, or you can do a stationary bike if you want to do low impact. So however way you do it, as long as it's a steady state activity, you can sustain for long periods of time, and you can track your heart rate. So the key thing is also tracking your heart rate.
So they could use a device for that, or just the old-fashioned way, measure your.
It's hard to measure like this when you're running or you're walking. So I recommend the Apple Watch or Fitbit or even a pulsometer, right? Yeah. Something you put on your fingertip to measure oxygen saturation. Usually it'll tell you your heart rate as well. So you can wear a pulse ox. Although if you have a watch, it just works even better.
Yeah. Okay. Wow, what great tips. And it's that seems simple for people to do. And of course, like you can build up to it too. If you're totally sedentary now, like don't try to do all that at once. Build up to it and
just do 5 minutes. And then that's all you can do. Just do 5 minutes. Yeah. But the next day, go for 5.5 minutes. The day after that, go for 6. Build your way up.
So great. I love that advice. Thank you so much for talking about these important issues today and letting people know the simple place to start with, just really for any chronic condition, it's going to help them, but specifically with what we talked about today. So, Dr. Khan, thank you so much for being a guest on Wellness by Design today.
Thank you so much for having me.
And thanks to everyone who's listening or watching. And if you know someone that needs to hear this, please share this with them. Have a great day. Bye.